Hello, I'm Dr. Jennifer Skofis, and I'm the Chief Medical Officer for the Health and Wellness Center. And I'm here today. We're going to talk about some HIV, AIDS, all kinds of good stuff. So get ready. Hello, everybody. Today we're here to talk about ending the HIV epidemic. So did you guys even know that was still a thing, HIV? Or did you think it was kind of like the dinosaur on the slide there and it was extinct and we didn't even have to worry about it anymore? Actually, HIV is increasing in the state of Oklahoma. So we're going to talk today about a lot of things. I'm going to warn you, some of the words I'm going to use might be offensive, but we're just going to be super frank about everything and use the correct terms. So if you get offended, that might mean you need to learn a little bit more about this subject. So what is HIV? Does anybody know what it stands for? It stands for Human Immunodeficiency Virus. It's a little tiny virus that infects the fluids of your body, and then it attacks later on the immune cells so that you can't fight off infection. So you get kind of weird infections that are very difficult to treat, and it just keeps doing this over and over again until one of these infections finally kills the person that has HIV. Do you know what AIDS is and what AIDS stands for? AIDS stands for Acquired Immunodeficiency Syndrome. And AIDS is just the presentation of illness when you do have an infection with the HIV virus. So AIDS is when you start getting sick. So people with HIV can have HIV for quite some time before they develop any illnesses and get sick with what we call now AIDS. Does anybody know who's at risk for getting HIV infection? Everyone's at risk. So if you are having sex, you're at risk. If you're using IV drugs, you're at risk. And when I say having sex, I mean all kinds of sex. If you're a man having sex with a female having sex with a man having sex with a man, you can get HIV. So anytime you're having sex where bodily fluids are exchanged, you can transmit or receive the HIV virus. So how about treatment? Does anybody know how we treat HIV? HIV is treated with oral medication. Back when we first had our first medications, people had to take multiple pills throughout the day and set timers on their watches so that they would know when to take them, because it was very specific dosing, and we didn't have Apple Watches back in the 80s. So, you had to get the old Casio digital watch to get your medicines taken on time.
And a Casio.
And now we have several formulations of medication where you can just take one pill a day. It's amazing. And you can suppress the virus for years and years, and even for a lifetime. So how about, can it be cured? There's one case of a lady, I believe she's in California, where they think she's actually been cured. But by and large, we don't consider HIV a curable disease. It is a lifetime disease where you take suppressive medicine, meaning the medicine keeps the virus at bay and from making you sick with AIDS or some strange infection, and you take it for the rest of your life to keep that virus suppressed. There's a big campaign. We call it U=U. And so if you take your medicine on a regular basis, your virus in your blood becomes undetectable. So that's the first U. And if your virus is undetectable, you can't transmit AIDS. So undetectable equals untransmittable. U equals U. It's fantastic. We've come a long way since the discovery of this virus in treatment, and hopefully we're going to come a long way now again in Oklahoma with our prevention. So how do you get it? We kind of talked about this a little bit. You get it through sex. You get it through drugs. You get it through blood transfusions. Not anymore. We used to see some blood transfusion cases of HIV, but once the test for HIV was developed, then they test all the blood that is donated so that we're not transfusing any blood that would be HIV positive. Back before we had the test, and we didn't really even know how it was transmitted, a handful of people, and by a handful, hundreds of thousands, were infected with the HIV virus through blood transfusions. So that was a big problem that we've kind of avoided to this point now. It can also be transmitted through breast milk. It can be transmitted from a mother to her fetus. So if a mother is pregnant, we can transmit it. There are medications that we give pregnant women who are positive for HIV that will prevent the transmission to the baby so they can safely carry the baby and not have their newborn infected with the virus. So that's another wonderful stride that we've made. So what are the symptoms? Let's say you were infected with HIV one day. How do you know? What would happen? So usually it takes several weeks and you start to have some symptoms kind of like, let's say like you have with COVID, you kind of get tired, you get some swollen lymph nodes, you might get a cough, you kind of have some diarrhea, you just feel cruddy, kind of like with any virus. And so that's the first symptom that you would have. It's not until later on, once the virus really attacks those immune cells, that you can become susceptible to some of those really bad infections that we see in patients that are infected with HIV and then develop AIDS. So, does anyone know how HIV is diagnosed? It's a very simple blood test. We can test for antibodies, which, again, I'll bring COVID up. Everybody seems pretty familiar now with viral testing. So you can test for antibodies, and that's kind of what we test with COVID to see if you've had it. So same thing, an exposure, your body makes an antibody. You can test for another thing called an antigen, and that's actually the HIV part that's infected, if you will. And that is actually when you go and you have the horrible nose swab for COVID, that is a test for antigens sometimes. And you can also do something called PCR testing, which actually pulls the actual pieces of the virus and does some RNA and DNA testing on them to see if you are positive. Again, with COVID, the big nasal swab that used to take 3 days to come back, that is the same type of test as that. So we started this presentation saying ending the HIV epidemic. So that wasn't my idea. It's actually a government program led by the CDC that was started in 2019. So the goal of ending the HIV epidemic, or EHE, as you see on the slide, is to end the epidemic by 2030. And we want to do this through prevention, keeping people from getting HIV, diagnosis. We want to test everyone we possibly can, even your grandma. So everyone from 13 to 65 gets an HIV test, and that's become the standard. Mm-hmm. So treatment, so people that are already infected, we want to make sure that they are on treatment and on the latest treatments to make them undetectable. So, and then outbreak response. So if we have a group of people in a certain area of the country that seem to be having rising rates of HIV, we want to identify that group and get them all tested and under control with our medications to prevent further spread of an outbreak. So kind of makes sense. So we want to reduce infections by 75% by 2025, and then by 90% in 2030, which is that goal for ending the HIV epidemic. Right now, we're just in phase 1, and the CDC has identified 57 geographic focus areas, and that means 57 places where HIV infections seem to be increasing. Now, those 57 are counties, usually counties or cities, areas of the country where we're seeing it. So, for example, like Miami-Dade County, maybe they had a big increase in infections over the last several years. That was identified, so that's a focus area. 9 whole states were also identified that had increasing rates of HIV, and Oklahoma is one of those states. Can you believe that? We just kind of live in a little small area and we don't think about it. But yes, Oklahoma is definitely having increased HIV rates. So put a couple of definitions up here of an epidemic. So that's just a widespread occurrence of infections or disease in a community at a particular time. So again, a state or a county would be where an epidemic takes place. And then, of course, we all know about the pandemic now, and that's a widespread epidemic that may affect a whole country, a whole continent, or even the entire world, which is what we saw over the last 2 years. So as you can see in this slide, we're kind of comparing HIV and COVID and the flu epidemic of 1918. So we've all heard a lot about the Spanish flu of 1918 since we've had another pandemic a little over 100 years later. So as you can see, we've got cases and deaths comparing the 3 pandemics that we've had in the last 100 years. And, you know, the 37 million, and it says PLHIV, so that's persons living with HIV. So that's a common term in the HIV community and in the medical community of what you say when you're speaking of someone who is HIV positive, a person living with HIV. And then, of course, you can see the deaths are not nearly as much for HIV as they are for COVID and, of course, the 1918 flu pandemic. Of course, in 1918, we didn't have much treatment. We didn't have a lot of knowledge about things like washing your hands and wearing a mask, and everybody was farmers, and they, you know, we couldn't shut the world down in 1918. So there are about 38,000 newly diagnosed HIV cases each year in the United States. And the Ending the HIV Epidemic project wants to reduce that eventually by 90%. It's 38,000 too many. So we do have a risk of a resurgence of this epidemic due to sex, drugs, and rock and roll, you know, all the fun stuff. So back in the 80s, when this really came out, so to speak, we got really serious about prevention and condoms and talking a little bit more about sex and how to prevent HIV. And now that we know that it can be treated, we've all gotten a little lax on really talking about this. And that's why the numbers go up. So that's what happens with COVID when we stop wearing our masks and start gathering in big groups. We see outbreaks. So it's kind of the same thing. So other things that have contributed to increases in cases are things like homophobia, transphobia, and just people being not aware of the ways that other people choose to live their lives and being afraid and discriminating against people. So if we all get together and say, oh, we don't care about the gay community, well, then we're not going to be helping the gay community. So if we ignore people and we don't take good care of people and we don't care about them, their rates are going to increase. And so we all have to be kind to one another and tolerant of one another. And that actually will help reduce rates. So it's pretty simple. So let's talk about strategies that we can do for prevention of HIV and, of course, treatment as well. So prevention, you know the definition. It just means doing something so that something else doesn't happen. And in this case, of course, doing something so you don't contract HIV. And then, of course, treatment is what we do for someone who does contract HIV. And then the third term there, harm reduction, is one you may not have heard of, but harm reduction means doing something to lessen the harm related to things like sexual behavior and drug use. So we'll get back to that in just a minute. So prevention, there's a little something called PrEP. It's called pre-exposure prophylaxis. So that's when, let's say, I live a very high-risk sexual lifestyle. I'm all over town. Anybody, everybody, all the time. So that puts me at very high risk for contracting HIV as well as many other things. So I can take medicine that prevents me from contracting HIV. So it's actually some of the HIV medicine that someone positive would take, but it prevents you from ever being able to get it. So anybody that lives a high-risk lifestyle, whether it be high-risk sexually, IV drug use, or anything that might increase their risk for HIV, they can take PrEP therapy. And we provide that. It's very simple, 1 pill a day, and frequent HIV testing as well. Then this PEP, that's post-exposure prophylaxis. So if I'm in surgery, operating, and somebody sticks me with a needle, and the patient is HIV positive, and I get stuck with a needle that had been in that patient, I can take the same medicine post-exposure. So I've had an exposure to HIV, and now I don't want to get HIV. So I take medication for a certain amount of time and have frequent HIV testing until we're assured that I am negative. Harm reduction is one of my favorite topics, and Oklahoma just passed a new law where harm reduction strategies are able to be used. So the most probably familiar thing that you would know about harm reduction would be a syringe exchange. So I'm an IV drug user. Not really, but let's just say that. I'm also not promiscuous, but for the purpose of the talk. If I'm an IV drug user, I don't want to use dirty needles because that increases my risk for HIV. So we always talk about don't share needles. What can I do to guarantee that I always have a clean needle? It's kind of hard to get needles if you aren't a diabetic or don't need them for some other medical reason. And harm reduction is where I can go in and either exchange a dirty needle or just say, look, I'm a drug user and I need some clean needles. And then those are given to me, usually free of charge. So that had been basically illegal in Oklahoma until last year when we passed that law. So now we can do that as long as the needles we're not giving are paid for with government funds. So, donations, private stock, things like that, we can now do syringe exchange. Of course, harm reduction includes condoms, something as simple as condoms. You're having sex. You want to reduce the harm that can be caused by having sex. You wear a condom. It's not rocket science, you guys. It's pretty simple. So at the Health and Wellness Center, we have a lot of donated condoms. The new ones, not the used ones. So we can give those out. We do a lot of education. We do a lot of training at Health and Wellness so that we can encourage people to employ harm reduction in their day-to-day lives if necessary. So what can I do to prevent HIV? We've talked a lot about some strategies, but we'll just kind of go through it again because this is the most important part. Probably nobody has HIV that you know, so nobody's warning you about it. So I'm going to warn you 100 times during this presentation. Be smart about sex. I'm not saying you need to not ever have sex. I'm saying if you have sex with a new partner, you need a condom. I don't care if you're a boy having sex with a girl, a boy having sex with a boy, girl, boy, whatever combination, wear a condom, especially if you don't know them and you don't know their HIV status. Because guess what? They don't know your HIV status either. So that's back to the condom. Needle sharing, make sure that, maybe nobody is using needles here, but somebody you know is, I promise. Make sure that people that you know or in your life or yourself get clean needles if they're going to use drugs. You want to ask a lot of questions. Go on a date.
Hi, I'm Date Mike. Nice to meet me. How do you like your eggs in the morning?
It's okay to ask somebody their HIV status if you don't know them. I mean, a lot of people are on Tinder. You don't know these people, so ask them. And kind of something people are doing now actually is bringing a sexual passport to dates so that you can see these were my results taken 1 week ago. So, kind of a new thing, kind of strange sounding, but it's safe, and safe is what we want. So the most important thing is get tested. If you've never had an HIV test, you need one. I don't care what, who, how is going on in your life. Everyone needs to be screened for HIV at some point in their life. It used to only be pregnant women that would get screened, but we're really trying to incorporate this screening into our yearly exam. So you go in, you get your cholesterol checked, you get checked for diabetes, you get checked for HIV. So we all want to have at least one screening in our life and then rescreen anytime you have a change in your behavior, like the behaviors that we talked about previously. So lastly, what else can I do to prevent HIV? What else can you do to prevent HIV? You just need to start the conversation. It doesn't need to be taboo. It is not just for the gay community. It is for the entire community. In fact, the rates in Oklahoma that are increasing are in all kinds of people, not just the gay community. It's in the Native American community, the female community. So you really want to talk about it, and you really want to be careful with your prevention. And don't forget, condoms aren't just for HIV. Condoms prevent other sexually transmitted diseases because usually a person with one sexually transmitted disease may have another one. We've had a huge syphilis outbreak in Oklahoma recently. So condoms can prevent things like syphilis and herpes and genital warts and anal warts and chlamydia and gonorrhea and all kinds of stuff you haven't even heard of that will destroy your sex life for the rest of your life. So be careful.